I'm Dr. Ryan Stanton, and the doc is in. Well, there's been a ton of questions about the big, beautiful bill and legislation and what it may mean in terms of access and impact on emergency medicine. Well, whether it's related to this legislation or not, a significant amount of our rural healthcare systems are under risk. A current study suggests about 700 rural hospitals across this country are at risk of closure, and 300 are at imminent risk of closure, with over 300 looking to either scale back resources or cut out resources altogether. Now, this is very important because the feeling that your zip code and location should not determine your outcomes. Able to have access, emergency service in your community or near your community is integral for the healthcare system. Now, the key here is that many of these areas run a very narrow margin and are very dependent on support from state and federal sources. This is simply because of the financial impacts of the area, the insurance status, and those that are overall uncovered. We know that this legislation and other legislation may decrease some of that coverage and put these further at risk and potentially over the edge. The key here is that we want to make sure that we advocate and support rural communities and critical access communities to have some level of access with regard to emergency services and emergency care. You can join the conversation on our Doc is In Facebook page and at Everyday Med on X. I'm Dr. Ryan Stanton, and the doc is out.